Well, I'm really excited about what PIONEER-OLE is telling us about mavacamten, and more importantly about the promise for our patients with obstructive hypertrophic cardiomyopathy, or HCM. What we've seen, first of all, is that our patients are able to get their symptoms improved quickly. They go from a New York Heart Association Class 2 or Class 3 often down to Class 1 relatively quickly and stay there for the duration of the trial that we've seen up to 1 year. We've seen that the gradient, which is a manifestation of how much that obstruction is, comes down very, very quickly. More than that, we're seeing that the patients are continuing to do well with their activities of daily living as measured by the New York Heart Association, and we're seeing some really promising signs. We're seeing that the septum, which is thickened in these patients, is actually getting smaller at progressive points that we're measuring. Really exciting about what we're seeing. Well, EXPLORER-HCM is our pivotal phase 3 program for mavacamten in obstructive hypertrophic cardiomyopathy. In this study, patients are randomized evenly between being treated with mavacamten and placebo. Patients are symptomatic with obstructive HCM, which means that they have an elevated gradient, either at rest or with exercise. They're treated with mavacamten or placebo for 30 weeks. And our primary endpoint is to look at improvements in their symptoms and their function as measured by New York Heart Association class, as well as peak VO2.